Happy International Women's Day. Today on International Women's Day, let us prioritize a critical aspect of women's health which is often overlooked. Cervical cancer, it develops in the woman's cervix, which is the lowestmost part of the uterus. Nearly all cervical cancers are caused by HPV, which is a human papillomavirus, and it is sexually transmitted. So once a woman gets a HPV infection, it can have multiple causes. 60% of the HPV infection can regress to normal. 15% may progress to high-grade lesions, but over a matter of 3 to 4 years. And 30 to 70% can progress to invasive cancer at a period of 10 to 20 years. So it's a very slowly progressing disease. Certain factors may put you at a higher risk for developing cervical cancer. Firstly, it is early age when you start sexual activity. So if a girl starts to become sexually active at a very early age, then she is at a very high risk of developing cervical cancer. Second, multiple sexual partners. A woman who has multiple sexual partners is also at a high risk of developing cervical cancer. If a woman has other sexually transmitted diseases like syphilis, gonorrhea, chlamydia or HIV/AIDS, then she is also at a high risk of developing cervical cancer. Then if a woman has weakened immunity, that can put her at a higher risk. And lastly, smoking is also associated with a high risk of developing cervical cancer. So preventing HPV infection will prevent cervical cancer. So how do we prevent HPV infection? We have an effective HPV vaccine available in the market and it's in the form of a simple IM injection. It is best given to women before they become sexually active. So the ideal age for giving the vaccination is between 9 to 14 years, and 2 doses of the vaccine is required, once at 0 month and then once after 6 months. But after 14 years of age also the woman can have the vaccine. So from 15 to 45 years of age a woman can also have HPV vaccination, but she will require 3 doses of the vaccine. So at 0 months, 2 months and then 6 months. Now this is called the primary prevention of cervical cancer. That is, before the woman becomes sexually active, we prevent her from getting the HPV infection. Other methods for preventing cervical cancer is by screening, and that is to determine whether women have early, easily treatable precancerous lesions, and this is secondary prevention. Now the screening methods available to us are pap smear, liquid-based cytology, HPV test and colposcopy. Every woman who is sexually active should have a pap smear or a liquid-based cytology every 3 years and till she is 60 years of age. After that, the frequency of having the pap smear or the liquid-based cytology can be reduced to 5 yearly till she is 75 years of age. Now this pap smear, it is a very simple test which can be done in the clinic. The next, we can have a HPV testing done as well, which helps us to triage women who are at a higher risk of having cervical cancer. So if a woman is found to be HPV positive, then she is at a higher risk of developing cervical cancer. So these women should have pap smear or liquid-based cytologies yearly. Rather than having it 3 yearly, they should be having it yearly so that we can detect any precancerous lesions as quickly as possible. The last screening method is colposcopy. Now colposcopy is a visual examination of a magnified image of the cervix after applying a dye on the cervix. Regular screening identifies precancerous lesions, allowing for timely intervention before they develop into full-blown disease. On this International Women's Day, let us commit into making cervical cancer screening a norm and not a luxury, and also getting all women vaccinated against HPV, where every woman has the opportunity of living a life free from the fear of cervical cancer. Thank you.